Well, Dr. Lance Walsh of Walsh Urology is here with Dr. Frank Kerrigan to teach us more about BPH, what it is, and how it can be treated. Men, listen up closely. Welcome back to the show.
Hey, thank you.
Nice to see you as always.
You too.
And welcome to the show, Doc.
My pleasure.
How are you?
Great, thanks.
Good. So I got a few questions. I'm going to start with you, Dr. Kerrigan. For those who don't know, what is BPH?
BPH is enlargement of the prostate that occurs with most men as we age gracefully. 70% of men by the age of 70 have symptomatic BPH.
So by the age of 70, most men?
A lot of them.
Okay.
Yes.
So treatment for men who come to you for symptoms of BPH, what does the treatment look like?
As with anything, you discuss what's perhaps exacerbating it. A lot of men, particularly here in the Valley, are having too much fun.
Sounds like a problem.
Drinking too much coffee because of the night before, and we're enjoying our wine, and so booze needs to be cut back. Fluids at bedtime need to be cut back. And certain foods might stimulate the bladder that are caffeinated. So you can talk about behavioral changes that might help with the symptoms.
So how effective are medications when it comes to treatment of BPH?
They're quite effective, but they're not without risk, especially as we age. A lot of these meds really work well, but there's drug-to-drug interactions that occurs with them. You've got to be careful. You got to watch the patient closely, but they can be effective.
So when is the time for a patient to be referred to a urologist?
You know, when you've hit the behavioral aspect, when you've maximized the medications, when the symptoms become so pronounced that all the above is not helping, and it's starting to really interfere with quality of life. And that's when you think about asking Lance to help out with some pretty simple surgical procedures.
Okay, so that leads me to you. So why is it important that a patient gets treatment?
Well, if people don't get treated, then they can develop problems down the road. I mean, one of the most fearsome problem is that they can't urinate and need a catheter, which is not fun. Other problems they can have are they can get infections, they can get bladder stones, and so a really basic issue is that it really can affect their quality of life. So not getting enough sleep or not being able to sit through a show.
Do you want to walk us through this picture we have here?
So on the left is the normal anatomy. You see the bladder that's smooth-walled and a urethra that's not obstructed. On the right is an end-stage bladder, which is thickened. Bladder's a muscle, and when it has to work harder, it becomes more thickened. And the prostate is obstructing the urethra. And by that time, it's really difficult to reverse the process. So when people start to have obstruction of the prostate, we'd like to treat them before they get changes to their bladder.
Tell me about treatment. What does it look like?
So there's medications, of which there's two different classes. There's alpha blockers like Flomax that relax the prostate muscle. There's Proscar, which reduces the conversion of testosterone to dihydrotestosterone. Both of those can cause sexual side effects, and the Flomax can cause dizziness. The traditional surgical approach is a transurethral resection of the prostate. It's done in the hospital under an anesthetic, and it can also cause sexual problems, about an 8% risk of erectile dysfunction. Most people will not be able to have an ejaculate. It'll be a dry orgasm. And then there's about an 8% risk of stricture. And then finally, there's a newer treatment option that's almost as effective as a TURP in terms of the improvement in the symptom score and the quality of life the patient has after the procedure. But it's the only treatment for BPH that has absolutely no sexual side effects. And there's good 4-year data that shows durability. And it's FDA approved, and most insurances, not all, but most insurances cover it.
And does not affect your sex life, which is important to all of us men, or those of us who are having sex. You can find Walsh Urology in Rancho Mirage. Schedule an appointment or consultation by giving them a call or check out their website at walshurology.com. Big thanks to Dr. Walsh and Dr. Kerrigan for being here. I learned something. Men, go get your prostates checked out. We'll see you after the break.